So most diabetic advice is written for men, but women experience diabetes differently, from hormones and pregnancy to social expectations and emotional stress. Women have it different. Today, let's talk about the unique challenges women face and how they can take control of their health with clarity and confidence. First, let's talk hormones. Estrogen and progesterone affect how a woman's body responds to insulin. That's why sugar levels often fluctuate in women during their menstrual cycles, during pregnancy, perimenopausal age, and during menopause. Some women feel tired, bloated. They crave sugar just before their period. That's not weakness. It's hormonal insulin resistance. Now, let's talk about polycystic ovarian syndrome. Polycystic ovarian syndrome affects 1 in 5 women in India. That's very high. It causes weight gain, irregular periods, acne, and facial hair in women. But here's what many don't realize. PCOS is strongly linked to insulin resistance. If untreated, it increases the risk in a woman to develop type 2 diabetes, even in their early 20s and early 30s. Managing polycystic ovarian syndrome isn't just about gynecology. It's about metabolic health also. Now, gestational diabetes. During pregnancy, women develop gestational diabetes. Gestational diabetes is common in Indian women. It can actually affect the baby's weight also. And the mother is at increased risk for developing diabetes in the future. If caught early and managed well through food, exercise, and sometimes insulin, it can be controlled without harming the baby. Many women feel guilty when they're diagnosed with gestational diabetes. But it's not your fault. It's not the woman's fault at all. It's biology. What matters is taking action early. So Radhika, a 36-year-old friend of mine from Hyderabad, came to me in her second pregnancy. She had gestational diabetes during her first pregnancy. She was terrified. She was worried that will it happen again. This time, she started a diabetes-friendly diet in her first trimester of pregnancy itself. She walked 20 minutes every day. She cut back on her sugar. She had regular checkups. Her sugar stayed in range. Her baby was born healthy and she felt empowered, not anxious. Diabetes doesn't mean a woman has to give up all the dreams of motherhood. It just means she needs the right support. Let's not forget the emotional burden women go through. Women often put family first. They cook separately for others, eat last, ignore their health. It's time to flip that script. A healthy woman is the strength of a healthy home. So what can you do? If you're a woman, track your cycle and sugar levels to understand your pattern. Watch for early signs of PCOS. Watch for early signs of gestational diabetes when you're pregnant. Prioritize protein, movements, and sleep. Be active. Speak up your health. And if you're a husband, a son, or a brother, support the woman in your life. Thank you for joining me on Sugar Unfiltered. In the next episode, we talk about foot care and complication. What happens when diabetes is ignored for too long? Until then, respect your hormones, protect your body, never feel ashamed for putting your health first.